Hello everyone, it's Dr. Yazdani here. I'll be talking about cholecystitis today. Inflammation of the gallbladder, which is usually caused by an obstructing gallstone. The gallbladder is a small pear-shaped organ under the liver. Its main purpose is to store and concentrate bile, a substance that helps digest fats in your food. Gallstones are usually made of cholesterol. They're very common and affect 1 in 10 adults in the UK. They don't usually cause symptoms, but may occasionally cause pain or acute infection of the gallbladder, known as cholecystitis. Acute cholecystitis is potentially serious because of the risk of complications. It usually needs to be treated in hospital with intravenous fluids and antibiotics. The main symptoms of acute cholecystitis is a sudden sharp pain in the right upper hand side of the abdomen, which may also radiate to the right shoulder. The affected part of the tummy is usually very tender, and breathing deeply can make it worse. The pain of acute cholecystitis is usually persistent and does not go away. Some people may have symptoms such as fever, nausea, vomiting, and jaundice. It's important to diagnose acute cholecystitis as soon as possible, because serious complications can develop if treatment is not started promptly. Acute cholecystitis is most commonly caused by stones, but in about 5% of patients it can happen without any stones and is usually more serious. This type of cholecystitis is known as a calculous cholecystitis. It is less common, but as I said, is usually more serious. The investigations used to diagnose cholecystitis include blood tests and ultrasound scans. Uncomplicated cholecystitis may be treated conservatively. The stone causing obstruction may fall back into the gallbladder and the inflammation may settle down. In some cases, however, removing the gallbladder or cholecystectomy may be recommended to prevent recurrence and reduce the risk of potentially serious complications. It's not always possible to prevent acute cholecystitis, but you can lower the risk of developing it by reducing your risk of getting gallstones. One of the main things you can do is to adopt a healthy, balanced diet and reduce the high cholesterol food you eat. Being overweight, particularly being obese, also increases your risk of developing gallstones. That's about it for now. Until next time, it's goodbye, and thank you for watching.